from Community Health Screen UK. My name is Dr. Mekella Mehmet Yesil, and today we're going to be talking about diabetes. And on the show we have a very famous young lady by the name of Dr. Serap Ihsan, who's going to be joining me to talk about diabetes. Welcome to the show, Dr. Ihsan.
Thank you very much, Mekella, for inviting me along. It's a pleasure. So my name is Dr. Ihsan. I'm a GP. I'm originally Turkish Cypriot. I've been practicing in North London as a general practitioner.
Well, thank you for coming on the show today for us, Dr. Ihsan. We're going to talk about diabetes and the two types of diabetes that are out there at the moment. We know there's type 2 and type 1. Can you tell us a little bit about the differences, if you don't mind?
Yeah, so absolutely. So diabetes is essentially a problem with the glucose monitoring system in the body. So when we eat foods, naturally our glucose levels, which is the sugar, rises. And our bodies need a mechanism by which to control the blood glucose level to ensure that it's within the normal limits. That's when an organ called the pancreas comes into practice. So the pancreas is an organ that sits behind the stomach, and its main function is to produce insulin. Insulin is what helps control the blood sugar levels. So when we talk about diabetes, as you quite rightly said, there's two types. Type 1 is common in young children, so it's normally diagnosed type 1 at a young age. And that's when the pancreas isn't producing any insulin. Whereas type 2 is when the pancreas is producing some insulin, but quite not enough, or the body isn't responding to the insulin. So type 1 diabetics are usually on injections, insulin injections. That's right. That's because, like I said, they're not producing any insulin. Whereas type 2 diabetics tend to be managed with diet, lifestyle, exercise, plus or minus medication as well.
Right, like metformin, for example.
Absolutely, yeah.
Right, okay. Yeah. So with type 1 diabetes, you say the body doesn't produce the insulin, so I'm taking it that they have to inject themselves with the insulin to get the glucose spike, is that correct?
Yeah, so when we eat food, shortly after this, our glucose levels go up. So what type 1 diabetics will have to do will be to inject themselves either sort of just before or during or shortly after eating to help bring down that glucose level. There are different types of insulin though, naturally. So you've got short-acting, rapid-acting, and then you've got longer-acting insulin injections, or even mixed insulin injections.
Yeah, that's right. So with the metformin, people who are on metformin who are producing too much, for example, with their glucose, is there certain lifestyle strategies that they need to adapt to bring the glucose down, would you say?
Absolutely, and I think the misconception is that type 1 diabetics, because they rely on insulin, then they shouldn't conform to a healthy, balanced lifestyle. Well, actually, they should. Everyone needs to sort of try and apply that healthy living. So you want a low sugar diet, low fat, low salt, but also the importance of exercise is really, I mean, it's very important. Exercise not only will help patients to lose weight, which in turn can help reduce the glucose levels, but actually the exercise also improves the
absorption,
effectiveness of insulin. So like I said, in type 2 diabetics, where the body isn't perhaps responding as well to the insulin, which is called insulin resistance, exercise will help. So it's a combination of dietary sort of changes, lifestyle exercise, as well as medication.
Yeah, it makes a lot of sense actually. And do you think with type 2 diabetes, because I remember reading somewhere many years ago, that certain people were resorting to strategies where they were having something done to their pancreas or removing certain parts of it to stop the insulin spikes or what have you, or diet, like 24-hour dieting or something to reset the pancreas? Is that true? Is there some sort of like...
I mean, there's a lot of things out there, isn't there? But what we really know is that people think they have to go on a special diabetic diet. Actually, and eat diabetic foods. But actually, the evidence suggests that what you need is a healthy, balanced diet. So you want to ensure that you're still eating your fruit and vegetables, which are also a very good source of fibre. Also, you want to include protein, unsaturated fats, and also making sure that you drink lots of water. There isn't a specific diet, and always conservative measures are sort of advised, I would say. I don't know enough about the procedures in terms of trying to get your blood sugars down, but what we do understand about diabetes is that it's a chronic condition.
That's correct,
it's about managing your symptoms, making the changes, and trying to continue with that.
Yeah, absolutely. So we know a little bit about diabetes itself. Are they hereditary, or do you think there could be genetic factors? Are they predisposed conditions that we need to know about, do you think?
So type 1 diabetes, which we touched on, as we said, presents early on. So you tend to diagnose it in young children. The symptoms are usually quite acute, which means that people can become quite unwell very quickly.
Yeah, that's correct.
Whereas type 2 diabetes, it's more a gradual onset, and most of the time people aren't aware until they go and speak to a healthcare professional or have a blood test, for example.
That's right,
For type 1 diabetes, what we do understand is that if you have a first-degree relative that suffers with diabetes,
like a mother or a father,
a mother, father, or a sibling, then there is slight increased risk of developing diabetes. So there is a genetic sort of predisposition, slightly. Type 2 diabetes, the main risk factors are increasing age, so that we're looking at 40 plus. Also ethnic background as well, so in Southeast Asians and also Afro-Caribbean individuals are more at risk. Weight, so obesity is another huge risk factor. There is also, again, slight increased risk with family history. So if you have, again, a first-degree relative that suffers with diabetes, you are at a slightly increased risk of developing type 2 diabetes as well.
Interesting. So what sort of signs, we say in children, like with the insulin, how would a parent look for the condition in their children, for example? What signs would they be showing, representing?
The most common symptoms are feeling thirsty. That could be one thing. Maybe passing a lot of urine. Feeling tired a lot of the time, maybe some weight loss, and some visual disturbances as well.
Interesting.
But sometimes we do see, so acutely unwell children might come in with like a stomach bug, or you think it's just nausea, vomiting. It's so important to always think about diabetes as a possible underlying cause.
That's interesting. Thank you for that very vital bit of information, Dr. Ihsan. That's very kind. We'll move along to our third question. How do people manage their condition, other than obviously the medication? I mean, we talk about diet and lifestyle. What other things do you think are paramount in managing their condition? Like foot health or any other symptoms on their skin, for example? So
in terms of lifestyle, we've already touched on a little bit about it. It's about making sure you have a healthy, balanced Mediterranean diet, if you like. So there's a lot of myths around diabetes as well. So a lot of people think that they shouldn't be eating fruit, for example.
Well, actually, sugar.
Yes. Well, actually, you should still try and aim to have 5 portions of fruit and vegetable a day. What you want to avoid is drinking lots of fruit juice, for example, freshly squeezed.
Well, not freshly.
Yes, because that can lead to huge spikes in the glucose levels.
And what about fizzy drinks?
Well, I'd be against fizzy drinks.
That's good to know.
Because it's really good to know. And also whole grain.
We should avoid whole grains.
Yes, because potato, believe it or not, has a lot. You might think of it, it's a vegetable, but actually it has a lot of starch. It's a carbohydrate, and has a lot of sugar. And like I said, avoid sort of fatty foods, essentially avoid eating salty food, because what's important is if you have diabetes, you want to make sure that your blood pressure is also well controlled.
Absolutely.
You want to make sure that your cholesterol is well controlled. Absolutely. Because if you can imagine, diabetes is a condition where your blood is very sticky and your blood becomes very thick. And if you can imagine your blood going through the bloodstream, it causes damage to the blood vessels. And that leads on to what you was asking about, sort of complications and long-term effects, is it can affect your blood vessels. So it can damage them, causing furring of the blood vessels, increases your risk of stroke and even heart disease. It can affect the blood vessels at the back of the eye, which is really important.
So eye screening would be
absolutely. So once a year, all diabetic patients are called up at the hospital for eye screening, and also it can affect your kidneys.
Absolutely, that's correct.
So in addition to this, it can affect your nerves. And you might have heard of something called peripheral neuropathy, which primarily sort of can affect any nerves, but in terms of the feet, it can affect the sensation. So what we mean by the feeling in your feet, so that if you do injure yourself, you might not be aware of it.
That's correct,
and that can lead to an ulcer or a wound, which then doesn't heal properly because of the limited blood supply and circulation. So it's really important that diabetic patients try and check their feet on a daily basis, is what I would say.
Or if they bruise themselves and don't realise how they got the bruise there in the first place.
Then to seek medical advice. Because the sooner you pick up on these things, the more you can sort of manage them appropriately, and hence avoid long-term complications, amputations even.
That's horrendous, isn't it, when you think of it like that? Just touching on the diet, we talked about the Mediterranean diet. Now, again, I do lots of research myself. There's this thing called the rainbow diet. I don't know if you've heard of it. So basically, the order you eat your food in, so aim for your vegetables and your greens first, and then eat the protein and then the carbs last, because that prevents the insulin from spiking. Is there
the glucose levels?
The glucose levels,
Yes.
Is that correct?
Yes, absolutely. Well,
so the order we eat the food in plays a significant part in glucagon and glucose. Is that correct? From one spiking and one dropping. Is that correct?
I think so. Yes. Yes.
Something along those lines.
And also low glycemic index foods.
That's it. Low glycemic. That's the one. Yeah. Right, long-term complications again. So someone's got type 1 diabetes, which can't be reversed, but with type 2 we can aim to reverse it possibly in the future. Again, lifestyle changes, diet, 20 minutes walking a day. How do you feel about that? Someone walking for 20 minutes?
Yeah, absolutely. So what we normally do is anyone who we diagnose as type 2 diabetes, we'll give them a period in which to try lifestyle modification. And a 3 month is a good length of time. We touched about it before. In terms of exercise, we're not talking about joining the gym. You don't have
weights.
to
We don't want to be pumping weights.
No, exactly. Although, strength exercises are obviously very important as well. But essentially what you want to be doing is getting your heartbeat up a little bit, feeling a little bit sweaty. And if you can, so for example, brisk walking is a good form of exercise by which you can do that. So if you can walk 30 minutes a day, 5 times a week, so we're looking at 150 minutes per week, ideally. But the important thing is to start small. So even if you start with 5 minutes a day or 10 minutes a day, you can even break it up into 15 minutes. So you can do 15 minutes in the morning, 15 minutes in the evening, then gradually build up the exercise levels. Things like swimming, cycling, light jogging, anything that you can manage really. A lot of people sort of think that housework is enough, but actually
that's an old myth, isn't it?
You
have that a lot.
Exactly.
They're thinking that 15 minutes of housework is enough to do. What else was I going to touch on? So the intermediate fasting, obviously it's Ramadan at the moment. A lot of people who are type 1 or type 2 diabetes, with their medications, do they still have to take them at certain times? Is it still important? Do they bypass Ramadan? Or is fasting a good way of cleansing the cells and cleansing the
I think it's very important that they continue with their medication. The problem with diabetes is if your blood sugars are not well controlled over a long period of time, especially, that's when you end up with the long-term complications. So I really have to stress the importance of making sure that they do take their medication appropriately to avoid any complications.
That's brilliant. That's absolutely brilliant. And again, with the foot health and stuff like that, obviously to see a foot doctor to get the toenails cut or something, or
Absolutely.
pedicures?
So they can see the podiatrist, and to make sure that they don't have any sharp edges to their nails, which can in turn cause wounds. They can book an appointment with a healthcare assistant or one of the nurses at their practice for a yearly foot check, and they'll do certain tests at that appointment, including testing the circulation, so they check the pulses in the feet, as well as do the sensation test, which we touched on earlier as well, in terms of looking out for signs of peripheral neuropathy.
That's really good as well. Thank you for that. There's another subject I just want to touch on just briefly about the fasting. A lot of people have this thing in their minds that they can reverse the type 2 diabetes if they do fast for 18 hours, 3 days consecutively. There was some research back in 2017. What are your views on that at the moment?
I've not come across that research.
You haven't come across it? Again, people are asking me sometimes where the markers are. What's an average glucose range for a normal person?
So there's 2 types of tests, which we didn't talk about previously in terms of diagnosing diabetes. It's a blood test. Now it's called the HbA1c, which measures the amount of glucose that is attached to your red blood cells. Because actually the glucose likes to attach to red blood cells. And the specific level that we look for is 48. Once your HbA1c goes above 48, that's a diagnosis for diabetes.
That's 48 people, not 4.8, 48.
48. Now, there is a borderline sort of range as well, what we call pre-diabetes, which you may have heard of, which basically means that you haven't quite met the threshold for meeting diabetes, but you're at high risk. So you have to be careful. So that's when your HbA1c is between 42 and 47.
42 and 47, okay.
So that's the HbA1c, which is a blood test organised by your GP. A lot of people tend to test their blood sugars, using the sort of the glucose monitoring test, which...
Would you say they're accurate?
Well, the thing is with those is that tells you what your blood sugar is doing in that moment of time. So if you'd just eaten and you test your blood sugar, well, you'd expect your blood sugar to be high. Whereas the HbA1c gives you an indication of what your blood sugars have been doing over the past 3 months. So it's a lot more accurate.
And you have to be fasting to do one of those tests, is that right?
Actually, no.
You don't?
No.
Okay.
No.
Right, so you don't have to...
That's right. So that's the HbA1c, and that's... We would, if we find a positive result, then we will often sort of repeat it as well, just to confirm. And obviously, like we said before, we'll always start by advising dietary lifestyle modification first and see if the patient responds. Weight loss is also very, very important. If you can try and lose weight about 5 to 10%, that will help reduce your HbA1c.
That's if their BMI is over and above what the national limit is that correct?
Absolutely.
Yeah. So if they're not obese, they don't need to worry about the weight, but they need to manage their condition.
Absolutely.
That's really helpful. Is there anything you'd like to add to that, Dr. Ihsan?
I think the most important thing is for patients to take some responsibility. I think once you're diagnosed with diabetes, it's about taking responsibility for your own health and managing your condition. Of course, healthcare professionals can be there to help support you, but this is a long-term condition. What you want to avoid is the long-term complications.
Absolutely, 100% there. I'd really like to thank you for coming along the show today. It's been really nice having you.
Thank you
everyone for watching, and this has been Community Health Screen. Thank you very much.